Question 1. The control framework reveals that during a complex cardiac interventional procedure, the radiographer observes that the fluoroscopy time is extending beyond initial estimates, and the cumulative dose displayed on the system is steadily increasing. The interventional cardiologist is focused on achieving optimal catheter placement. Which of the following actions best upholds radiation safety principles within the ARRT exam's regulatory context? Option A. Continue fluoroscopy at the current settings without interruption, assuming the cardiologist is aware of the dose and will indicate if adjustments are needed. Option B. Immediately cease fluoroscopy and inform the cardiologist that the dose is becoming excessive, regardless of the procedural stage. Option C. Increase the radiation output to improve image clarity, believing that a clearer image will shorten the overall fluoroscopy time. Option D. Actively utilize collimation to restrict the fluoroscopic field to the area of interest. Consider employing pulsed fluoroscopy if image quality permits, and ensure the lowest practical frame rate is used while maintaining diagnostic visualization. The correct answer is D. Actively utilize collimation to restrict the fluoroscopic field to the area of interest. Consider employing pulsed fluoroscopy if image quality permits, and ensure the lowest practical frame rate is used while maintaining diagnostic visualization. Explanation. This scenario presents a common challenge in cardiac interventional radiography, balancing the need for diagnostic image quality with the imperative of minimizing radiation exposure to both the patient and the staff. The professional challenge lies in the dynamic nature of interventional procedures, where fluoroscopy time can be unpredictable, and the operator must constantly assess and adjust radiation parameters. Careful judgment is required to ensure adequate visualization for safe and effective intervention without unnecessary radiation dose. The correct approach represents best professional practice because it prioritizes ARRT as low as reasonably achievable principles, a cornerstone of radiation safety regulations in the United States, as governed by the Nuclear Regulatory Commission, NRC, and state-level radiation control programs. Specifically, it involves actively employing dose reduction techniques such as collimation, pulsed fluoroscopy, and optimizing frame rates, all of which are directly supported by ARRT exam content and regulatory guidelines. This approach demonstrates a proactive commitment to radiation safety, aligning with the ethical responsibility to protect all individuals from harmful radiation. An incorrect approach that relies solely on the lowest possible radiation output without considering image quality would be professionally unacceptable. This fails to meet the diagnostic requirements of the procedure, potentially leading to suboptimal imaging, increased fluoroscopy time as the operator struggles to visualize anatomy, and ultimately a compromised patient outcome. This violates the principle of providing adequate diagnostic information while also potentially increasing overall dose due to repeated or prolonged imaging. Another incorrect approach that involves disregarding the cumulative dose displayed on the radiation monitoring system is also professionally unacceptable. Cumulative dose display is a critical tool for real-time dose management. Ignoring it prevents the operator from making informed decisions about continuing or modifying the procedure based on accumulated exposure, thereby increasing the risk of exceeding acceptable dose limits for both the patient and staff. This directly contravenes regulatory requirements for dose monitoring and management. A further incorrect approach that involves prioritizing speed of the procedure over radiation safety measures would be professionally unacceptable. While efficiency is important, it must never come at the expense of radiation protection. This approach demonstrates a disregard for established safety protocols and regulatory mandates, potentially leading to significant radiation overexposure. The professional reasoning process for similar situations should involve a continuous assessment of the ARRT principle in conjunction with diagnostic image quality. This includes understanding the capabilities of the imaging equipment, utilizing available dose reduction features, actively monitoring cumulative dose, and communicating effectively with the interventional team regarding radiation status. Professionals should be trained to recognize when image quality is compromised and to adjust parameters accordingly, always erring on the side of caution regarding radiation exposure. Question 2. Investigation of the cardiac chambers and their relative positions is critical for accurate contrast delivery during a left ventriculogram. Which of the following anatomical relationships best describes the location of the left ventricle relative to the right ventricle and the interventricular septum? Option A. The left ventricle is located superior and to the left of the right ventricle, separated by the interventricular septum. Option B. The left ventricle is located posterior and to the left of the right ventricle, separated by the interventricular septum. Option C. The left ventricle is located inferior and to the right of the right ventricle, separated by the interventricular septum. Option D. The left ventricle is located anterior and to the right of the right ventricle, separated by the interventricular septum. The correct answer is B. The left ventricle is located posterior and to the left of the right ventricle, separated by the interventricular septum. Explanation: the ARRT certification in cardiac interventional radiography (PSI) exam requires a thorough understanding of cardiac anatomy and physiology as it pertains to interventional procedures. This scenario is professionally challenging because accurately identifying and differentiating cardiac structures is paramount for safe and effective contrast administration, catheter manipulation, and ultimately, successful patient outcomes. Misidentification can lead to incorrect contrast injection, potential damage to cardiac structures, or suboptimal diagnostic imaging, all of which have significant clinical and ethical implications. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the cardiac chambers and their relative positions, which is essential for guiding interventional devices and contrast media. This aligns with the ARRT emphasis on foundational knowledge for safe and competent practice. Specifically, understanding the flow of blood through the heart and the anatomical landmarks of each chamber allows the technologist to anticipate the trajectory of catheters and the distribution of contrast, thereby minimizing risks and maximizing diagnostic yield. This knowledge is directly tested by the exam's focus on cardiac structure. An incorrect approach that relies solely on visual cues without a deep understanding of the underlying anatomy is professionally unacceptable. This could lead to misinterpretation of imaging findings, incorrect procedural steps, and potential patient harm. For instance, mistaking the left ventricle for the right ventricle during contrast injection would result in contrast being delivered into the pulmonary circulation instead of the systemic circulation, leading to inaccurate diagnostic information and potentially adverse hemodynamic effects. This failure to apply foundational anatomical knowledge violates the ethical obligation to provide competent patient care and adhere to established professional standards, as implicitly assessed by the ARRT certification. Another incorrect approach might involve focusing only on the immediate procedural step without considering the broader anatomical context, which can lead to errors in subsequent steps or a failure to recognize potential complications arising from anatomical variations. This demonstrates a lack of comprehensive understanding and can compromise patient safety, a core tenet of radiography. The professional reasoning process for similar situations should involve a systematic approach. First, recalling and applying foundational anatomical knowledge of the heart's structure and blood flow. Second, correlating this knowledge with the real-time imaging being acquired. And third, anticipating the consequences of each procedural action based on this integrated understanding. This ensures that decisions are not made in isolation, but are informed by a robust comprehension of cardiac anatomy and its functional implications in the interventional setting. Question 3. What factors determine the optimal imaging approach and interpretation of cardiac hemodynamics during interventional procedures, considering the underlying pathophysiology of common cardiac diseases? Option A. The radiographer's personal preference for specific imaging planes and the fluoroscopy time limit set by the department. Option B. The brand of the imaging equipment and the number of technologist assistants available. Option C. The specific type and severity of myocardial ischemia, the presence and degree of valvular stenosis or regurgitation, and the extent of structural cardiac abnormalities such as septal defects or ventricular aneurysms. Option D. The patient's body mass index and the availability of contrast media. The correct answer is C. The specific type and severity of myocardial ischemia, the presence and degree of valvular stenosis or regurgitation, and the extent of structural cardiac abnormalities such as septal defects or ventricular aneurysms. Explanation: this scenario is professionally challenging because it requires the radiographer to integrate a deep understanding of cardiac pathophysiology with the practical application of imaging techniques in a dynamic patient environment. The ability to recognize subtle pathophysiological changes and correlate them with imaging findings is crucial for accurate diagnosis and effective patient management, directly impacting the quality of care provided in cardiac interventional procedures. The correct approach represents best professional practice because it emphasizes a comprehensive understanding of the underlying disease processes that influence cardiac function and appearance on imaging. This aligns with ARRT certification standards, which require a thorough knowledge of anatomy, physiology, and pathology relevant to cardiac interventional radiography. By considering the interplay of factors like myocardial ischemia, valvular dysfunction, and structural abnormalities, the radiographer can optimize imaging protocols, interpret findings accurately, and communicate effectively with the interventional team, thereby ensuring patient safety and diagnostic efficacy. This approach is directly supported by the ARRT emphasis on clinical competence and the application of scientific knowledge in practice. An incorrect approach that focuses solely on technical parameters without considering the underlying pathophysiology would be professionally unacceptable. This failure would represent a lack of clinical judgment and a deviation from best practices, potentially leading to misinterpretation of images or suboptimal procedural guidance. Such an approach could be considered a breach of professional responsibility, as it neglects the critical link between the patient's disease state and the imaging process. Furthermore, it fails to meet the ARRT expectation of a radiographer who can apply knowledge to real-world clinical situations, potentially compromising patient outcomes and violating ethical principles of providing competent care. Another incorrect approach that prioritizes speed over diagnostic accuracy would also be professionally unacceptable. While efficiency is important in interventional settings, it must not come at the expense of thoroughness and accuracy. Rushing through image acquisition or interpretation due to time constraints without considering the pathophysiological implications could lead to misdiagnoses or incorrect assessments, directly impacting patient care and safety. This demonstrates a failure to adhere to the professional standard of care and the ethical obligation to provide accurate diagnostic information. Professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, a thorough review of relevant medical history, and a comprehensive understanding of the specific cardiac pathology suspected or confirmed. The radiographer must then correlate these factors with the dynamic imaging findings, continuously assessing the impact of the pathophysiology on the cardiac structures and function being visualized. This iterative process of assessment, imaging, and interpretation, guided by a strong foundation in cardiac pathophysiology, ensures that the radiographer provides the most accurate and clinically relevant information to the interventional team. Question 4. When evaluating a patient for a cardiac interventional procedure requiring iodinated contrast media, which of the following represents the most critical initial step in determining the appropriate contrast agent and mitigating potential risks? Option A. Verifying the patient's body mass index, BMI, to calculate the maximum allowable contrast volume. Option B. Confirming the patient's glomerular filtration rate, GFR, and reviewing their history for any known allergies to iodinated contrast media. Option C. Inquiring about the patient's recent travel history to assess exposure to infectious diseases. Option D. Assessing the patient's current hydration status and ensuring adequate intravenous access for potential emergency medications. The correct answer is B. Confirming the patient's glomerular filtration rate, GFR, and reviewing their history for any known allergies to iodinated contrast media. Explanation. This scenario is professionally challenging because it requires the radiographer to synthesize patient history, potential procedural risks, and the properties of various contrast media to ensure patient safety and procedural success. The decision-making process involves a critical assessment of contraindications, potential adverse reactions, and the specific needs of the cardiac interventional procedure. Adherence to ARRT standards and established clinical guidelines for contrast administration is paramount. The correct approach represents best professional practice because it prioritizes patient safety by identifying and mitigating risks associated with contrast media. This involves a thorough review of the patient's medical history, including renal function, allergies, and previous reactions to contrast agents. Selecting a contrast agent with a favorable risk-benefit profile for the specific patient and procedure, and ensuring appropriate prehydration and post-procedure monitoring aligns with the principles of patient-centered care and regulatory requirements for safe practice in cardiac interventional radiography. An incorrect approach that involves administering a contrast agent without a comprehensive review of the patient's renal function would be a significant regulatory and ethical failure. This could lead to contrast-induced nephropathy, a serious complication that violates the duty of care and potentially contravenes guidelines from organizations like the American College of Cardiology and the Society for Cardiovascular Angiography and Interventions regarding contrast safety. Similarly, administering a contrast agent to a patient with a known severe allergy to its components, without appropriate prophylactic measures or consideration of an alternative, represents a direct violation of patient safety protocols and ethical obligations, potentially leading to anaphylaxis. Overlooking a history of previous adverse reactions to iodinated contrast media and proceeding with the same agent without further investigation or alternative selection is also a failure to adhere to best practices in patient assessment and risk management. Professional reasoning in such situations should involve a systematic approach. First, thoroughly review the patient's chart for any documented contraindications or risk factors. Second, consult with the supervising physician or cardiologist regarding any ambiguities or high-risk factors. Third, select the most appropriate contrast agent based on the patient's condition and the procedural requirements, considering factors like osmolality, viscosity, and iodine concentration. Finally, ensure all necessary precautions, such as prehydration and patient education, are implemented. Question 5. Strategic planning requires a radiographer to anticipate and address potential challenges in achieving optimal image quality for cardiac interventional procedures. When evaluating an acquired fluoroscopic image for diagnostic adequacy, which of the following considerations best reflects a comprehensive understanding of image formation and quality assurance within the ARRT certification framework? Option A. Relying solely on the automatic exposure control (EEC) system to maintain consistent image brightness, assuming that the system will automatically compensate for all variations in patient anatomy and positioning to produce a diagnostically acceptable image. Option B. Systematically evaluating the image for appropriate spatial resolution, contrast, noise levels, and artifact presence, correlating these factors with the selected imaging parameters, KVP, M as filtration, collimation, and patient dose, and making informed adjustments to optimize diagnostic information while adhering to ARRT principles. Option C. Prioritizing the reduction of patient radiation dose by selecting the lowest possible KVP and M as settings, even if it results in increased image noise and potentially reduced spatial resolution. Option D. Assessing the overall brightness and contrast of the image to ensure it appears visually appealing and clearly delineates anatomical structures, making minor adjustments to KVP or M as is needed to achieve the desired aesthetic. The correct answer is D. Assessing the overall brightness and contrast of the image to ensure it appears visually appealing and clearly delineates anatomical structures, making minor adjustments to KVP or M as is needed to achieve the desired aesthetic. Explanation. The scenario presents a common challenge in cardiac interventional radiography: achieving optimal image quality for diagnostic interpretation while minimizing patient radiation dose. This requires a deep understanding of image formation principles and their practical application within the regulatory framework governing medical imaging in the United States, as mandated by the ARRT for the CI certification. The challenge lies in balancing competing factors such as spatial resolution, contrast, noise, and dose, all of which are influenced by technical parameters and equipment performance. The correct approach prioritizes patient safety and diagnostic efficacy by systematically evaluating image quality parameters and their impact on dose. This aligns with the fundamental principles of radiation protection, ARRT as low as reasonably achievable, and the ARRT emphasis on competent practice. By understanding how factors like KVP, M as filtration, and collimation affect image contrast, noise, and spatial resolution, the radiographer can make informed adjustments to optimize the image without unnecessary radiation exposure. This proactive approach ensures that the images are not only diagnostic, but also acquired in the safest manner possible, adhering to established professional standards and regulatory guidelines. An incorrect approach that focuses solely on achieving a visually bright or dark image without considering the underlying technical factors, and their dose implications is professionally unacceptable. This demonstrates a superficial understanding of image formation and a disregard for radiation safety principles. Such an approach could lead to images with excessive noise, requiring repeat exposures, or insufficient diagnostic information, thereby compromising patient care and violating the ARRT principle. Furthermore, failing to consider the impact of scatter radiation or the appropriate use of contrast agents on image quality and dose represents a failure to adhere to best practices and potentially regulatory requirements for quality assurance. Another incorrect approach might involve relying solely on automatic exposure control (EC), without understanding its limitations or the need for manual override in specific situations. While AEC can be a valuable tool, improper setup or unexpected patient anatomy can lead to suboptimal images and potentially increased dose. A professional radiographer must be able to critically assess AEC performance and intervene when necessary, demonstrating a comprehensive understanding of image formation and dose management. The professional reasoning process for such situations involves a systematic evaluation of the imaging chain. This includes assessing patient factors, size, condition, equipment capabilities, generator, detector, collimator, and procedural requirements. The radiographer must then apply knowledge of physics principles to select appropriate technical factors, KVP, M as pulse rate, filtration, and imaging techniques, collimation, contrast enhancement, to achieve the desired image quality while adhering to dose optimization strategies. Regular quality assurance checks of equipment and ongoing professional development are crucial to maintaining competence in this dynamic field. Question 6. Compliance review shows that in a busy cardiac interventional suite, technologists are sometimes expediting the pre-procedural patient assessment by relying on verbal confirmation from the ordering physician for certain details, rather than independently verifying them against the patient's chart and the consent form. This practice has led to occasional discrepancies in the documented pre-procedural checklist. Which of the following approaches best aligns with ARRT certification standards for cardiac interventional radiography and ensures optimal patient safety? Option A. Relying primarily on the patient's verbal confirmation of their name and date of birth, with the assumption that patients are generally accurate about their own information. Option B. Allowing experienced technologists to verbally confirm key patient identifiers and procedural details with the circulating nurse, assuming their knowledge is sufficient to bypass a full chart review for routine cases. Option C. Delegating the entire pre-procedural assessment to the physician, with the technologist only performing the physical setup of equipment once the physician indicates readiness. Option D. Implementing a mandatory, multi-point electronic pre-procedural checklist that requires direct technologist input and verification against patient records and consent forms before proceeding with any patient preparation for a cardiac interventional procedure. The correct answer is D. Implementing a mandatory, multi-point electronic pre-procedural checklist that requires direct technologist input and verification against patient records and consent forms before proceeding with any patient preparation for a cardiac interventional procedure. Explanation. This scenario presents a common implementation challenge in cardiac interventional radiography, where a critical pre-procedural assessment step is inconsistently applied. The challenge lies in balancing the need for thorough patient preparation with the dynamic nature of interventional procedures and potential time constraints. Ensuring all required elements are addressed before a procedure is paramount for patient safety and procedural success. Directly aligning with ARRT standards for competent practice. The correct approach represents best professional practice because it prioritizes a systematic and comprehensive pre-procedural checklist that includes verification of all essential patient information, consent, and readiness. This aligns with the fundamental principles of patient care and safety mandated by regulatory bodies governing radiologic technologists in the U.S. Specifically, it upholds the ethical obligation to provide competent care and adhere to established protocols designed to minimize risk. This systematic approach ensures that no critical step is overlooked, thereby safeguarding the patient and the integrity of the procedure. An incorrect approach that bypasses or inadequately performs the pre-procedural assessment is professionally unacceptable due to specific regulatory and ethical failures. Failing to verify patient identification and the correct procedure. For instance, directly violates Joint Commission standards and poses a severe risk of patient harm, such as performing the wrong procedure on the wrong patient. Omitting a review of allergies or relevant medical history can lead to adverse reactions or complications during or after the procedure, contravening the technologist's duty of care. Not confirming the availability of necessary equipment or medications can result in procedural delays or compromises, impacting patient outcomes and potentially violating facility policies designed to ensure efficient and safe care. These failures demonstrate a lack of diligence and a disregard for established safety protocols, which are foundational to professional practice in medical imaging. The professional decision-making process for similar situations should involve a commitment to a standardized pre-procedural workflow. This includes actively engaging with the patient and the healthcare team to confirm all necessary information. When faced with time pressures, the technologist must advocate for the completion of all critical safety checks, recognizing that patient safety supersedes expediency. A robust understanding of the potential consequences of each pre-procedural step, coupled with a commitment to continuous quality improvement and adherence to regulatory guidelines, forms the basis of sound professional judgment. Question 7. The efficiency study reveals that the informed consent process for cardiac interventional procedures at your facility is experiencing delays, impacting patient throughput and potentially increasing anxiety. Which of the following strategies would best optimize this process while upholding ethical and regulatory standards for obtaining informed consent? Option A. Delegate the primary responsibility for explaining complex interventional risks and benefits to a less experienced radiologic technologist who has recently completed basic competency training. Option B. Implement a standardized, interactive patient education module that is completed prior to the physician's detailed consent discussion, allowing the physician to focus on answering specific patient questions and confirming understanding. Option C. Streamline the consent process by having the patient sign the consent form immediately upon admission, with the understanding that detailed explanations will be provided later if the patient has concerns. Option D. Reduce the time allocated for the physician's consent discussion to a brief overview, relying on a pre-printed consent form with a comprehensive list of risks and benefits for the patient to review independently. The correct answer is B. Implement a standardized, interactive patient education module that is completed prior to the physician's detailed consent discussion, allowing the physician to focus on answering specific patient questions and confirming understanding. Explanation. The efficiency study reveals that the informed consent process for cardiac interventional procedures at your facility is experiencing delays, impacting patient throughput and potentially increasing anxiety. This scenario is professionally challenging because it requires balancing the imperative of efficient patient care with the non-negotiable ethical and regulatory mandate of obtaining truly informed consent. Rushing the process, even for efficiency, can lead to incomplete understanding, compromised autonomy, and potential legal or ethical repercussions. The correct approach represents best professional practice because it prioritizes patient autonomy and understanding, which are foundational to ethical medical practice and are explicitly addressed by ARRT standards and relevant U.S. federal regulations e.g. HIPAA, patient rights under Medicare/Medicaid, and common law principles of informed consent. Ensuring the patient comprehends the procedure, risks, benefits, and alternatives, and has ample opportunity to ask questions, is paramount. This approach upholds the patient's right to self-determination and minimizes the risk of adverse outcomes stemming from misunderstanding. It also aligns with the radiographer's professional responsibility to advocate for the patient and ensure their rights are protected. An incorrect approach that involves a checklist-driven, superficial discussion of risks and benefits without verifying patient comprehension is professionally unacceptable. This fails to meet the ethical standard of ensuring genuine understanding and violates the principle of patient autonomy. It can lead to patients agreeing to procedures without fully grasping the implications, potentially resulting in regret or dissatisfaction. From a regulatory standpoint, this could be viewed as a failure to obtain valid informed consent, which can have legal consequences for the institution and the individuals involved. Another incorrect approach, such as delegating the entire informed consent discussion to a junior staff member without adequate training or supervision in the nuances of cardiac interventional procedures, is also professionally unacceptable. This risks the transmission of incomplete or inaccurate information, undermining the patient's ability to make an informed decision. It also fails to uphold the professional responsibility of experienced practitioners to ensure the highest standards of patient care and education are met. Professionals should approach this situation by first analyzing the root causes of the delay. Is it a lack of dedicated time, insufficient patient education materials, or a communication breakdown? The decision-making process should involve a multidisciplinary team, including physicians, nurses, and radiographers, to develop strategies that enhance understanding without sacrificing thoroughness. This might involve implementing standardized educational tools, allocating specific time slots for consent discussion, and empowering all team members to identify and address patient concerns. The focus must remain on the quality of the patient's understanding and their voluntary agreement, not merely on the speed of the process. Question 8. Cost-benefit analysis shows that optimizing visualization of the entire coronary arterial tree, including distal branches and potential collateral flow, is crucial for accurate diagnosis and effective intervention planning in cardiac interventional procedures. Considering the ARRT certification in cardiac interventional radiography, exams focus on coronary circulation. Which of the following approaches best reflects the radiographer's professional responsibility in acquiring optimal imaging data? Option A. Deviating from standard imaging protocols to experiment with novel contrast injection techniques that may offer improved visualization, but have not been fully validated for diagnostic accuracy or safety in this patient population. Option B. Employing imaging protocols that systematically visualize all major coronary arteries and their significant branches, ensuring adequate ossification and minimal artifact, while remaining attentive to the physician's specific requests and any emergent findings. Option C. Prioritizing speed of image acquisition over image quality and completeness, assuming that any significant findings will be apparent even with suboptimal imaging. Option D. Focusing primarily on visualizing the proximal segments of the left main, left anterior descending, and circumflex arteries, as these are most commonly affected by atherosclerosis, and concluding the study once these areas are adequately visualized. The correct answer is B. Employing imaging protocols that systematically visualize all major coronary arteries and their significant branches, ensuring adequate ossification and minimal artifact, while remaining attentive to the physician's specific requests and any emergent findings. Explanation. This scenario is professionally challenging because it requires the radiographer to balance the immediate need for diagnostic information with the potential for patient harm and the efficient use of resources, all within the strict regulatory framework of ARRT certification in cardiac interventional radiography. The radiographer must possess a deep understanding of coronary anatomy and physiology to interpret imaging findings and guide subsequent interventions, while adhering to established protocols and ethical considerations. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by utilizing imaging techniques that provide the most comprehensive and reliable visualization of coronary anatomy and potential pathology. This aligns with the ARRT certification's emphasis on advanced knowledge and skills in cardiac interventional procedures, ensuring that the radiographer can contribute effectively to patient care and outcomes. Adherence to established protocols and physician guidance is paramount, as it ensures that procedures are performed within the scope of practice and in accordance with accepted medical standards. Incorrect approaches fail to meet professional standards due to several regulatory and ethical failures. One incorrect approach might involve prematurely concluding the imaging study based on a superficial assessment, which could lead to misdiagnosis of critical coronary lesions. This violates the ethical obligation to provide thorough and accurate diagnostic information and potentially compromises patient safety by delaying necessary treatment. Another incorrect approach could be to deviate from physician-ordered protocols without proper consultation or justification, which infringes upon the established chain of command and could lead to suboptimal imaging or patient harm. This demonstrates a failure to adhere to the professional responsibility of working collaboratively within the healthcare team and respecting established procedural guidelines. A third incorrect approach might involve focusing solely on one aspect of coronary circulation, neglecting other critical areas that could harbor significant pathology. thereby failing to provide a complete diagnostic picture and potentially leading to incomplete or inaccurate diagnoses. This reflects a lack of comprehensive understanding of coronary anatomy and its functional implications, which is a core competency for ARRT-CI certified professionals. Professional decision-making in such situations requires a systematic approach. First, the radiographer must thoroughly understand the clinical indication for the procedure and the specific information the referring physician is seeking. Second, they must possess a comprehensive knowledge of normal and abnormal coronary anatomy and physiology, enabling them to anticipate potential findings and interpret images accurately. Third, they must be proficient in operating the imaging equipment and employing appropriate techniques to optimize image quality and minimize radiation exposure. Fourth, they must maintain open communication with the physician, reporting findings promptly and seeking clarification when necessary. Finally, they must always prioritize patient safety and adhere to all relevant regulatory guidelines and institutional protocols. Question 9. The audit findings indicate a discrepancy between the recorded contrast media volume administered to a patient during a cardiac interventional procedure and the actual volume documented in the physician's operative report. The radiographer recalls administering a slightly lower volume than initially logged in the electronic health record. Which of the following actions best reflects appropriate professional conduct in this situation? Option A. Adjust the electronic health record to match the physician's operative report without further discussion, assuming the physician's report is the definitive record. Option B. Make a note in the patient's chart indicating the discrepancy, but take no further action to correct the recorded volume. Option C. Immediately consult with the supervising physician and the lead interventional technologist to report the discrepancy, discuss the potential implications, and follow established protocols for amending the patient's record. Option D. Ignore the discrepancy, as the difference is minor and unlikely to impact the patient's immediate outcome. The correct answer is C. Immediately consult with the supervising physician and the lead interventional technologist to report the discrepancy, discuss the potential implications, and follow established protocols for amending the patient's record. Explanation. This scenario presents a professional challenge due to the inherent risks associated with interventional procedures and the critical need for adherence to established protocols to ensure patient safety and procedural integrity. The audit findings highlight a deviation from standard practice, necessitating a careful evaluation of the radiographer's actions and the subsequent decision-making process. The correct approach represents best professional practice because it prioritizes patient safety and procedural accuracy by immediately addressing the identified discrepancy. This aligns with the ARRT Code of Ethics, which emphasizes the radiographer's responsibility to provide competent and ethical patient care, including the accurate documentation and reporting of all aspects of the procedure. Specifically, it upholds the principle of accountability and the commitment to maintaining the integrity of patient records, which are vital for continuity of care and legal compliance. An incorrect approach that involves overlooking the discrepancy or attempting to correct it without proper authorization or documentation would represent a significant regulatory and ethical failure. This could lead to inaccurate patient records, potentially compromising future treatment decisions and exposing the healthcare facility to legal ramifications. Furthermore, failing to report such findings to the appropriate personnel violates the principle of transparency and can hinder quality improvement initiatives. Another incorrect approach, such as fabricating documentation to conceal the error, is a direct violation of ethical conduct and professional integrity, constituting fraud and jeopardizing patient trust. Professionals should employ a decision-making framework that involves immediate identification of deviations, thorough assessment of the situation, consultation with appropriate supervisors or physicians, accurate documentation of the issue and resolution, and adherence to institutional policies and regulatory guidelines. This systematic approach ensures that patient care remains paramount and that all procedural and documentation standards are met. Question 10. The assessment process reveals a patient presenting with an ST elevation myocardial infarction, STEMI, requiring emergent cardiac catheterization and thrombectomy. The interventional cardiologist has indicated the need for thrombus removal prior to percutaneous coronary intervention, PCI. Considering the various thrombectomy techniques and devices available, which of the following represents the most appropriate radiographer-assisted approach to facilitate successful thrombus aspiration and minimize distal embolization, adhering to established ARRT-CI certification guidelines and U.S. regulatory frameworks for interventional procedures? Option A. Suggesting the use of a distal protection device in conjunction with a balloon angioplasty catheter, as this strategy is primarily designed to capture embolic debris generated during PCI, not as a primary thrombectomy tool. Option B. Preparing and assisting with the deployment of a large-bore aspiration catheter system, which is designed for rapid and efficient removal of thrombus from the occluded artery, with the radiographer ensuring optimal fluoroscopic guidance for precise placement. Option C. Proposing the use of a relytic thrombectomy catheter, which utilizes a high-pressure fluid stream to fragment and aspirate thrombus, but requires careful management to avoid vessel injury. Option D. Recommending and preparing the manual aspiration thrombectomy catheter for immediate use, as it is generally effective for large thrombus burdens and allows for direct visualization of aspirated material. The correct answer is D. Recommending and preparing the manual aspiration thrombectomy catheter for immediate use, as it is generally effective for large thrombus burdens and allows for direct visualization of aspirated material. Explanation. The assessment process reveals a critical scenario in cardiac interventional radiography, where a radiographer must select the most appropriate thrombectomy technique for a patient presenting with acute myocardial infarction. This scenario is professionally challenging because the choice of technique directly impacts patient outcomes, including reperfusion success, risk of distal embolization, and potential for procedural complications. Adherence to established protocols, physician guidance, and understanding the nuances of each thrombectomy device are paramount. The correct approach represents best professional practice because it prioritizes patient safety and efficacy based on current evidence-based guidelines and the specific clinical presentation. This involves a thorough understanding of the indications and contraindications for different thrombectomy devices, as well as the radiographer's role in assisting the physician in selecting and deploying the device. The radiographer's responsibility extends to ensuring proper equipment selection, optimal imaging acquisition to guide the procedure, and vigilant monitoring for any adverse events, all within the scope of practice defined by the ARRT and relevant regulatory bodies governing medical imaging in the United States. This aligns with the principle of providing high-quality patient care under the supervision of a qualified physician. An incorrect approach, such as unilaterally selecting a thrombectomy device without physician consultation or based on personal preference rather than clinical indication, represents a significant regulatory and ethical failure. This violates the principle of physician-led care and the radiographer's defined scope of practice, potentially leading to suboptimal treatment or patient harm. Another incorrect approach, such as failing to ensure the availability of appropriate imaging protocols for visualizing thrombus burden and device deployment, compromises the diagnostic and interventional quality of the procedure, which is a failure in adhering to established standards of care and regulatory requirements for diagnostic imaging. Furthermore, neglecting to anticipate and prepare for potential complications associated with thrombectomy, such as embolization or vessel dissection, demonstrates a lack of preparedness and adherence to safety protocols, which are implicitly mandated by regulatory frameworks ensuring patient safety in interventional procedures. Professional reasoning in such situations requires a systematic approach. First, understanding the patient's clinical presentation and the physician's preliminary assessment. Second, recalling and applying knowledge of available thrombectomy devices and their specific applications. Third, actively communicating with the physician to confirm the chosen strategy and any specific requirements. And finally, executing the procedure with meticulous attention to detail, ensuring optimal imaging and patient monitoring, all while operating within the established regulatory and ethical boundaries of the profession. Question 11. Compliance review shows a critical fluoroscopy system in the cardiac catheterization lab is exhibiting intermittent image degradation during a complex interventional procedure. The radiographer suspects a potential internal component issue, but the system is still producing diagnostic images, albeit with reduced quality. What is the most appropriate immediate course of action for the radiographer to maintain patient safety and regulatory compliance? Option A. Ignore the intermittent image degradation, assuming it is a minor issue that will resolve on its own, and continue the procedure as planned. Option B. Immediately inform the physician and contact biomedical engineering to report the equipment malfunction and request immediate assessment. Option C. Pause the procedure and attempt to troubleshoot the fluoroscopy system independently to identify and resolve the issue before resuming. Option D. Continue the procedure while attempting to adjust imaging parameters to compensate for the image degradation, and document the issue for later reporting. The correct answer is B. Immediately inform the physician and contact biomedical engineering to report the equipment malfunction and request immediate assessment. Explanation. Scenario analysis. This scenario presents a common challenge in interventional radiography. A critical piece of equipment malfunctions during a procedure. Professional challenge lies in balancing the immediate need to continue patient care with the imperative to maintain equipment integrity and adhere to regulatory standards for safety and documentation. The radiographer must make a rapid, informed decision that prioritizes patient well-being, while also ensuring compliance with established protocols for equipment maintenance and reporting. This requires a deep understanding of the equipment's operational parameters, potential failure modes, and the established procedures for addressing such issues within the healthcare facility and under ARRT guidelines. Correct approach analysis. The correct approach prioritizes patient safety and procedural continuity by immediately informing the physician and biomedical engineering. This aligns with ARRT certification expectations for cardiac interventional radiographers, who are expected to possess the knowledge and skills to operate and troubleshoot equipment safely. Promptly notifying the physician allows for immediate clinical decision-making regarding patient management and potential procedural modifications. Simultaneously, engaging biomedical engineering ensures that the equipment issue is addressed by qualified personnel, adhering to manufacturer guidelines and facility protocols for maintenance and repair. This systematic approach minimizes patient risk, ensures proper documentation of the event, and facilitates timely resolution of the equipment malfunction, all of which are critical for maintaining a safe and compliant interventional environment. This reflects the ethical obligation to provide competent patient care and uphold professional standards. Incorrect approaches analysis. Continuing the procedure without informing the physician or biomedical engineering is a significant regulatory and ethical failure. Directly compromises patient safety by proceeding with potentially compromised equipment, increasing the risk of adverse events. This also violates facility protocols for equipment malfunction reporting and ARRT standards for professional conduct, which mandate clear communication and adherence to safety procedures. Attempting to troubleshoot the equipment independently without proper training or authorization from biomedical engineering can lead to further damage, void manufacturer warranties, and potentially create an unsafe situation for both the patient and staff. This bypasses established safety and maintenance channels. Ignoring the issue and hoping it resolves itself is also a failure to act responsibly and ethically. It demonstrates a lack of commitment to patient safety and regulatory compliance, potentially leading to a more severe equipment failure or an adverse patient outcome. This approach neglects the professional duty to proactively manage risks. Professional reasoning. Professionals facing equipment malfunctions should follow a structured decision-making process. First, assess the immediate impact on patient safety and procedural integrity. Second, immediately communicate the issue to the supervising physician and relevant support departments, e.g., biomedical engineering. Third, consult established protocols and manufacturer guidelines for troubleshooting and reporting. Fourth, document the incident thoroughly, including the nature of the malfunction, actions taken, and communication with relevant parties. This systematic approach ensures patient safety, regulatory compliance, and efficient resolution of equipment issues, reflecting the highest standards of professional practice in cardiac interventional radiography. Question 12. Risk assessment procedures indicate a patient presence with symptoms suggestive of significant coronary artery disease, and a non-invasive stress test has shown concerning results. However, the patient has a history of moderate renal insufficiency and a known allergy to iodine-based contrast media. Which of the following represents the most appropriate initial approach for the cardiac interventional radiographer to take in preparing for a potential cardiac catheterization and angiography? Option A. Thoroughly review the patient's complete medical history, including detailed renal function tests and previous contrast reaction history, and consult with the cardiologist to discuss risk mitigation strategies and potential procedural modifications before proceeding. Option B. Proceed with scheduling the cardiac catheterization and angiography, ensuring adequate hydration and preparing for potential allergic reactions, as the diagnostic benefits outweigh the identified risks. Option C. Immediately cancel the cardiac catheterization and angiography and recommend alternative diagnostic imaging modalities without further patient-specific evaluation. Option D. Administer a standard dose of contrast media during the procedure, assuming the patient's renal insufficiency is manageable and the allergy is unlikely to cause a severe reaction. The correct answer is B. Proceed with scheduling the cardiac catheterization and angiography, ensuring adequate hydration and preparing for potential allergic reactions, as the diagnostic benefits outweigh the identified risks. Explanation. Scenario analysis. This scenario presents a common challenge in cardiac interventional radiography, where a patient's clinical presentation necessitates an angiographic procedure, but the risk assessment reveals potential contraindications. The challenge lies in balancing the diagnostic and therapeutic benefits of angiography against the patient's specific risks, requiring a thorough understanding of indications, contraindications, and alternative approaches within the ARRT scope of practice and relevant U.S. regulatory frameworks. Correct approach analysis. The correct approach prioritizes a comprehensive evaluation of the patient's specific risk factors in relation to the established indications for cardiac angiography. This aligns with the principles of patient safety and informed consent mandated by regulatory bodies like the FDA and professional standards set by organizations such as the American College of Cardiology (AC) and the Society for Cardiovascular Angiography and Interventions (SCI). A detailed review of the patient's medical history, including renal function, bleeding disorders, and contrast media allergies, is crucial. Furthermore, considering the patient's symptoms and diagnostic findings to confirm the necessity of angiography as the most appropriate diagnostic tool is paramount. This approach ensures that the procedure is indicated, the risks are understood and mitigated, and the patient's well-being is prioritized, adhering to the ethical and regulatory obligations of a certified CI radiographer. Incorrect approaches analysis. One incorrect approach would be to proceed with angiography solely based on a general indication, without a specific, individualized risk assessment. This fails to acknowledge the unique physiological status of the patient and could lead to adverse events, violating the principle of do no harm and potentially contravening FDA guidelines on medical device use and patient safety. Another incorrect approach would be to defer the procedure entirely without a thorough evaluation of potential risk mitigation strategies or alternative diagnostic pathways. While caution is warranted, a complete deferral without exploring all options might deny the patient necessary diagnostic information, potentially leading to delayed treatment and poorer outcomes, which could be considered a failure to provide appropriate care within the scope of practice. A third incorrect approach would be to proceed with the procedure while overlooking or downplaying identified risk factors, such as significant renal impairment or a history of severe contrast reactions, without implementing appropriate preventative measures or consulting with the physician. This demonstrates a lack of due diligence and a disregard for established protocols for managing contrast-related complications, which are critical for patient safety and regulatory compliance. Professional reasoning. Professionals should adopt a systematic approach to risk assessment for angiography. This involves 1. Confirming the clinical indication for the procedure based on current guidelines. 2. Conducting a thorough patient history and physical examination to identify potential contraindications and risk factors. 3. Reviewing relevant laboratory data, e.g., renal function coagulation studies. 4. Discussing findings and potential risks/benefits with the referring physician and the patient. 5. Developing a plan to mitigate identified risks, e.g., hydration protocols, alternative contrast agents, prophylactic medications. 6. Obtaining informed consent. This structured process ensures that decisions are evidence-based, patient-centered, and compliant with all applicable regulations and ethical standards. Question 13. The risk matrix shows a moderate to high likelihood of catheter-induced dissection during complex PCI procedures involving tortuous anatomy. Given this, Which of the following approaches best minimizes this specific risk while ensuring effective lesion crossing and stent delivery? Option A. Employing a stiff, high-support guide wire to rapidly advance through the lesion, paired with a large diameter catheter to facilitate stent deployment, regardless of anatomical tortuosity. Option B. Selecting a guide wire with a sharp, aggressive tip to easily penetrate any resistance encountered in the vessel, and a long, rigid catheter to provide maximum pushability. Option C. Relying solely on the physician's experience to navigate the anatomy without specific consideration for the catheter and guide wire system's properties, assuming standard equipment will suffice. Option D. Utilizing a low-profile, highly trackable guide wire with a forgiving tip shape, coupled with a catheter designed for deep vascular engagement and excellent torque control, while employing gentle, controlled manipulation techniques. Correct answer is D. Utilizing a low-profile, highly trackable guide wire with a forgiving tip shape, coupled with a catheter designed for deep vascular engagement and excellent torque control, while employing gentle, controlled manipulation techniques. Explanation: the risk matrix shows a moderate to high likelihood of catheter-induced dissection during complex PCI procedures involving tortuous anatomy. This scenario is professionally challenging because the interventional radiographer must balance the need for effective lesion crossing and stent delivery with the inherent risks associated with manipulating advanced catheter and guide wire systems in delicate vasculature. Accurate selection and manipulation of these tools are paramount to patient safety and procedural success, directly impacting outcomes and potentially leading to complications. The correct approach represents best professional practice by prioritizing patient safety through meticulous selection and utilization of the most appropriate catheter and guide wire based on anatomical considerations and procedural goals. This aligns with the ARRT standards for ethical conduct and professional responsibility, emphasizing the radiographer's role in minimizing patient harm. Specifically, choosing a system known for its trackability and low profile in tortuous vessels, and employing gentle, controlled manipulation techniques directly mitigates the risk of dissection. This proactive approach is supported by the principle of do no harm and the radiographer's duty to maintain competence in the use of advanced imaging and interventional equipment. An incorrect approach that involves selecting a catheter or guide wire without fully considering the anatomical challenges or the specific requirements of the lesion presents a significant regulatory and ethical failure. This could be seen as a deviation from accepted standards of care, potentially violating guidelines that mandate appropriate equipment selection for patient safety. Using a system that is too stiff or has a large profile in a tortuous vessel increases the risk of intimal damage, leading to dissection, which is a direct contraindication for such a choice. Another incorrect approach might involve aggressive manipulation of the guide wire or catheter, even with appropriate equipment, demonstrating a lack of technical proficiency or disregard for the delicate nature of the vasculature. This would be a failure to exercise due care and skill, which is a cornerstone of professional practice and regulatory compliance. The professional decision-making process for similar situations should involve a thorough pre-procedural assessment of the patient's anatomy and the lesion characteristics. This includes reviewing imaging, consulting with the physician regarding the planned approach, and anticipating potential challenges. The radiographer should then systematically evaluate available catheter and guide wire options, considering their specific properties, e.g., tip shape, shaft support, torque control, diameter, in relation to the identified challenges. A critical step is to select the system that offers the best balance of support, trackability, and deliverability while minimizing the risk of trauma. During the procedure, continuous assessment of the guide wire and catheter position and the patient's hemodynamic status is crucial, with a willingness to adapt the strategy if unexpected resistance or signs of complication arise. This iterative process of assessment, selection, and adaptation, guided by established best practices and regulatory expectations, ensures optimal patient care. Question 14. Benchmark analysis indicates that following a cardiac interventional procedure, a patient exhibits new onset, localized swelling, and a palpable bruit at the arterial access site, accompanied by a subjective complaint of increasing groin pain. What is the most appropriate immediate action for the certified radiologic technologist? Option A. Immediately notify the supervising physician or qualified medical professional of the patient's signs and symptoms. Option B. Administer a prescribed analgesic medication to manage the patient's reported pain. Option C. Reassure the patient and advise them to report any worsening symptoms later. Option D. Continue to monitor the patient's vital signs and document the findings for the next scheduled physician assessment. The correct answer is A. Immediately notify the supervising physician or qualified medical professional of the patient's signs and symptoms. Explanation. Scenario analysis. This scenario presents a common yet critical post-procedural complication in cardiac interventional radiography, a suspected pseudoaneurysm at the access site. The professional challenge lies in the immediate need for accurate assessment and appropriate intervention to prevent potentially life-threatening hemorrhage. The technologist's role is crucial in recognizing subtle signs, understanding the urgency, and initiating the correct chain of communication and action, all while adhering to established protocols and patient safety standards. This requires a deep understanding of potential complications, their clinical manifestations, and the immediate management pathways as defined by ARRT standards and relevant U.S. healthcare regulations. Correct approach analysis. The correct approach involves immediate notification of the supervising physician or qualified medical professional. This aligns directly with ARRT emphasis on the technologist's responsibility to recognize and report significant changes in a patient's condition. U.S. healthcare regulations, such as those pertaining to patient safety and emergency response, mandate prompt reporting of critical findings to ensure timely medical intervention. The technologist's role is to be the eyes and ears of the physician, identifying potential issues that require advanced medical expertise. This immediate reporting is paramount to preventing further deterioration and managing the complication effectively, thereby upholding the highest standards of patient care and professional accountability as expected for ARRT certification. Incorrect approaches analysis. Observing the patient for a prolonged period without reporting the findings to a physician is a significant failure. This delay directly contraindicates the principle of prompt patient assessment and intervention, potentially leading to adverse outcomes and violating patient safety regulations. It demonstrates a lack of understanding of the urgency associated with potential vascular complications. Administering medication to alleviate pain without a physician's order is a critical regulatory and ethical breach. Technologists are not authorized to prescribe or administer medications independently. This action constitutes practicing medicine without a license and violates established protocols for medication administration, which are strictly governed by U.S. healthcare laws and professional practice standards. Documenting the findings in the patient's chart and waiting for the next scheduled physician rounds is another unacceptable approach. While accurate documentation is vital, it is not a substitute for immediate reporting of a suspected critical complication. This delay in communication can have severe consequences for patient outcomes and represents a failure to adhere to emergency response protocols and patient safety mandates. Professional reasoning. Professionals in cardiac interventional radiography must develop a robust decision-making process that prioritizes patient safety and adheres strictly to regulatory frameworks. This process involves 1. Vigilant observation and recognition of potential complications based on procedural knowledge and patient presentation. 2. Immediate assessment of the severity and potential impact of the observed signs or symptoms. 3. Prompt and clear communication of findings to the appropriate medical authority, physician. 4. Understanding the scope of practice and limitations, particularly regarding medication administration and independent medical decision-making. 5. Following established institutional protocols for emergency situations and complication management. This systematic approach ensures that patient care is delivered efficiently, safely, and in compliance with all relevant U.S. regulations and ARRT certification requirements. Question 15. The risk matrix shows a moderate probability of hemodynamic instability during a complex cardiac interventional procedure requiring deep sedation. Which of the following actions best ensures patient safety and adherence to established protocols? Option A. Delegating the responsibility of monitoring the patient's sedation level to a circulating nurse who is not specifically trained in advanced cardiac life support. Option B. Confirming that the sedation is administered by a qualified provider, that continuous monitoring of the patient's vital signs and level of consciousness is in place, and that emergency resuscitation equipment is immediately accessible. Option C. Proceeding with the procedure after the anesthesiologist verbally confirms that the patient is adequately sedated, without further direct verification of monitoring equipment. Option D. Relying on the patient's ability to respond to verbal stimuli to gauge the adequacy of sedation throughout the entire procedure. The correct answer is B. Confirming that the sedation is administered by a qualified provider, that continuous monitoring of the patient's vital signs and level of consciousness is in place, and that emergency resuscitation equipment is immediately accessible. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent risks associated with deep sedation in a cardiac interventional suite. Patients undergoing these procedures are often critically ill, have multiple comorbidities, and are susceptible to hemodynamic instability. The primary challenge lies in balancing the need for patient comfort and immobility with the critical requirement for vigilant monitoring and prompt intervention in case of adverse events. The radiographer's role in recognizing subtle signs of decompensation and ensuring appropriate protocols are followed is paramount to patient safety. Correct approach analysis. The correct approach emphasizes the radiographer's responsibility to ensure that the patient's sedation level is appropriate for the procedure, and that the monitoring plan aligns with established institutional protocols and ARRT scope of practice guidelines. This involves confirming that the sedation is administered by qualified personnel, that the patient is continuously monitored for vital signs and level of consciousness, and that emergency equipment and medications are readily available. This approach represents best professional practice because it directly addresses patient safety by adhering to established safety standards for sedation and monitoring in interventional radiology, as mandated by regulatory bodies and professional organizations. It prioritizes patient well-being by ensuring a multidisciplinary approach to sedation management. Incorrect approaches analysis. One incorrect approach would be to assume the sedation is adequate solely based on the patient's initial presentation and not actively monitoring for changes. This fails to acknowledge the dynamic nature of sedation and the potential for delayed adverse effects. It violates the ethical principle of non-maleficence by potentially overlooking patient distress or compromise. Another incorrect approach is to proceed with the procedure without confirming the availability of emergency resuscitation equipment. This directly contraindicates established safety protocols for interventional procedures and creates an unacceptable risk to the patient should an emergency arise, violating standards of care and potentially ARRT practice guidelines regarding emergency preparedness. A third incorrect approach would be to delegate the responsibility of monitoring the sedation level to an unqualified individual. This is a direct violation of professional responsibility and regulatory requirements, as sedation management and monitoring require specialized training and expertise. It undermines the collaborative care model and places the patient at significant risk. Professional reasoning. Professionals in cardiac interventional radiography must adopt a proactive and vigilant approach to patient care, particularly concerning anesthesia and sedation. The decision-making process should involve a thorough pre-procedure assessment, confirmation of sedation orders and administration by qualified personnel, continuous monitoring of the patient's physiological status, and immediate recognition and response to any signs of compromise. This process is guided by institutional policies, ARRT scope of practice, and ethical principles, ensuring patient safety remains the highest priority. Question 16. Strategic planning requires anticipating potential adverse events during a cardiac interventional procedure. If a patient undergoing a percutaneous coronary intervention suddenly exhibits bradycardia, hypotension, and diaphoresis, what is the most appropriate immediate action for the radiographer? Option A. Immediately notify the interventional cardiologist and the nursing staff of the patient's change in status and prepare for potential emergency interventions. Option B. Continue the current imaging acquisition while observing the patient for further changes, assuming it may be a transient physiological response. Option C. Administer a prescribed emergency medication, such as atropine, based on the observed symptoms without direct physician order. Option D. Attempt to troubleshoot the imaging equipment to rule out technical factors contributing to the patient's symptoms before alerting the physician. Correct answer is A. Immediately notify the interventional cardiologist and the nursing staff of the patient's change in status and prepare for potential emergency interventions. Explanation. Strategic planning in cardiac interventional radiography necessitates a proactive approach to potential procedural complications. This scenario is professionally challenging because the rapid onset and potentially life-threatening nature of complications like cardiac tamponade demand immediate, decisive action. Radiographers must possess not only technical proficiency, but also a deep understanding of physiological responses and emergency protocols. The ARRT certification in cardiac interventional radiography, (PSI) exam emphasizes this by testing the ability to recognize subtle signs of distress and initiate appropriate management. The correct approach represents best professional practice because it aligns with established clinical guidelines and regulatory expectations for patient safety in interventional procedures. Prompt recognition of signs and symptoms, immediate communication with the physician, and adherence to the established emergency response plan are paramount. This ensures timely intervention, minimizes patient harm, and upholds the radiographer's role as a critical member of the healthcare team, acting within their scope of practice as defined by ARRT standards and relevant U.S. healthcare regulations. An incorrect approach, such as delaying notification of the physician while attempting to independently troubleshoot the equipment, represents a significant regulatory and ethical failure. This delay directly compromises patient safety by postponing necessary medical intervention, potentially exacerbating the complication. It violates the radiographer's ethical obligation to prioritize patient well-being and their professional responsibility to communicate critical patient status changes promptly. Furthermore, it may contravene specific guidelines within the U.S. regulatory framework that mandate immediate reporting of adverse events or patient deterioration to the responsible physician. Another incorrect approach, such as continuing the procedure as if no issue is occurring, demonstrates a profound disregard for patient safety and a failure to recognize emergent situations, which is a direct violation of professional standards and regulatory requirements for patient care. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and assess. Continuously monitor the patient for any changes in vital signs, appearance, or behavior. 2. Recognize and interpret. Identify potential signs of a complication based on training and experience. 3. Communicate immediately. Alert the physician and other team members without delay, providing clear and concise information about the observed changes. 4. Follow protocol. Adhere to the established emergency response plan and assist as directed within the scope of practice. 5. Document accurately. Record all observations, communications, and interventions. Question 17. Operational review demonstrates that the syningiography system's image acquisition is intermittently producing artifacts that are not consistent with patient anatomy or expected imaging parameters. The interventional cardiologist is preparing to initiate a complex coronary intervention procedure. What is the most appropriate immediate action for the cardiac interventional radiographer? Option A. Immediately cease operation of the syningiography system and report the artifact to the biomedical engineering department for immediate assessment and verification of image quality and system integrity before proceeding with any patient procedures. Option B. Proceed with the procedure using the system, but instruct the cardiologist to be extra vigilant in interpreting the images due to the potential for artifacts. Option C. Attempt to adjust the system's imaging parameters or perform a quick manual reset to resolve the artifact before the cardiologist begins the procedure. Option D. Continue with the planned coronary intervention procedure, documenting the observed artifacts and planning to address them during post-procedure quality control checks. The correct answer is A. Immediately cease operation of the syningiography system and report the artifact to the biomedical engineering department for immediate assessment and verification of image quality and system integrity before proceeding with any patient procedures. Explanation. This scenario presents a professional challenge because it requires immediate action to ensure patient safety and regulatory compliance in a critical care environment. The radiographer must balance the need for timely intervention with the strict requirements for equipment maintenance and quality assurance. The challenge lies in identifying the appropriate course of action when a piece of essential diagnostic equipment shows signs of malfunction, directly impacting patient care and potentially violating established protocols. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the ARRT standards and relevant U.S. regulatory frameworks for medical imaging equipment. By immediately reporting the anomaly and ceasing operation of the affected equipment until it is verified as safe and accurate, the radiographer upholds the principle of do no harm and ensures that diagnostic information used for patient management is reliable. This aligns with the fundamental ethical obligations of a radiographer and the regulatory mandates for equipment quality control, which are paramount in cardiac interventional radiography. An incorrect approach that involves continuing to use the equipment without proper verification poses significant regulatory and ethical failures. It violates the principle of providing accurate diagnostic information, potentially leading to misdiagnosis or inappropriate treatment, which is a direct breach of patient care standards. Furthermore, it disregards established quality assurance protocols mandated by regulatory bodies, such as those overseen by the FDA and state health departments, which require equipment to be functioning within acceptable parameters. Continuing to operate faulty equipment also undermines the integrity of the diagnostic process and could lead to disciplinary action by professional organizations and regulatory agencies. Another incorrect approach, such as attempting to self-repair the equipment without proper certification or authorization, is also professionally unacceptable. This action bypasses established maintenance procedures, potentially exacerbates the malfunction, and could lead to further equipment damage or unsafe operation. It also violates manufacturer warranties and service agreements, and importantly, it circumvents the required documentation and verification processes essential for regulatory compliance and quality assurance. The professional reasoning process for similar situations should involve a systematic approach. First, recognize and assess the potential impact on patient safety and diagnostic accuracy. Second, consult established protocols and guidelines for equipment malfunction reporting and resolution. Third, communicate the issue clearly and promptly to the appropriate personnel, such as biomedical engineering or lead radiographer. Fourth, follow established procedures for equipment deactivation and verification before resuming operation. This decision-making framework ensures that patient well-being and regulatory adherence remain the highest priorities. Question 18. Assessment of a patient undergoing a cardiac interventional procedure reveals a regular rhythm on the ECG monitor. The radiographer observes distinct P waves preceding each QRS complex, indicating atrial depolarization followed by ventricular depolarization. This observation is crucial for understanding the coordinated contraction of the atria and ventricles, which is directly influenced by the electrical conduction system. Which of the following best describes the significance of this observation in the context of the cardiac cycle and electrical conduction? Option A. The P wave's presence is largely irrelevant to the overall cardiac cycle and can be disregarded when assessing the patient's hemodynamic status. Option B. The observation solely indicates the mechanical pumping efficiency of the ventricles, irrespective of the electrical triggers. Option C. The presence of P waves preceding each QRS complex confirms normal sinoatrial (SA) node initiation and subsequent conduction through the atrioventricular AV node, ensuring effective atrial contraction before ventricular contraction. Option D. The radiographer should focus on the external pacemaker settings as the primary determinant of the cardiac rhythm, disregarding the intrinsic electrical activity. The correct answer is C. The presence of P waves preceding each QRS complex confirms normal sinoatrial (SA) node initiation and subsequent conduction through the atrioventricular AV node, ensuring effective atrial contraction before ventricular contraction. Explanation. This scenario is professionally challenging because accurately interpreting the cardiac electrical activity is paramount for patient safety and effective intervention during cardiac procedures. Misinterpreting the electrical conduction system's response to stimuli or its inherent rhythm can lead to inappropriate treatment decisions, potentially causing harm. The ARRT certification in cardiac interventional radiography (PSI) exam emphasizes the radiographer's role in monitoring and understanding these physiological processes. The correct approach represents best professional practice because it demonstrates a thorough understanding of the cardiac electrical conduction system and its relationship to the cardiac cycle, as required by ARRT standards for CI certification. This understanding allows the radiographer to accurately assess the patient's hemodynamic status and anticipate potential complications, ensuring adherence to established protocols and patient care guidelines. Regulatory frameworks, such as those overseen by the ARRT, mandate competency in interpreting physiological data relevant to interventional procedures. An incorrect approach that focuses solely on the mechanical pumping action without considering the underlying electrical triggers fails to meet the comprehensive understanding required for CI radiography. This oversight neglects a critical component of cardiac function and can lead to misdiagnosis or delayed recognition of electrical abnormalities, violating the principle of providing competent patient care as expected by regulatory bodies. Another incorrect approach that prioritizes external pacemaker settings over the intrinsic electrical activity of the heart is also professionally unacceptable. While pacemakers are crucial devices, the radiographer's primary responsibility is to understand the heart's natural electrical system and how it interacts with or is overridden by external devices. Failing to assess the intrinsic rhythm can mask underlying issues or lead to inappropriate adjustments of pacing parameters, contravening the expectation of independent clinical judgment and comprehensive patient assessment. A further incorrect approach that dismisses the significance of the P wave in the cardiac cycle demonstrates a fundamental lack of understanding of the electrical conduction pathway. The P wave represents atrial depolarization, a critical initial step in the cardiac cycle. Ignoring its presence or significance indicates a deficiency in the knowledge base expected of a certified CI radiographer, potentially leading to misinterpretation of arrhythmias and compromised patient care, which is a direct violation of professional competency standards. The professional reasoning process should involve a systematic evaluation of the cardiac rhythm strip, correlating the electrical events with the mechanical cycle. This includes identifying the P wave, QRS complex, and T wave, understanding their origins within the conduction system, and recognizing normal and abnormal sequences. When faced with complex rhythms or interventions, the radiographer must consult with the interventional cardiologist and adhere to established protocols, ensuring that all interpretations and actions are grounded in a solid understanding of cardiac electrophysiology and patient safety. Question 19. Comparative studies suggest that the selection of imaging equipment for cardiac interventional procedures significantly impacts both diagnostic image quality and patient radiation dose. When evaluating new fluoroscopy and digital systems for a busy interventional suite, which of the following approaches best aligns with current U.S. regulatory frameworks and ARRT certification standards for minimizing patient radiation exposure while ensuring diagnostic efficacy? Option A. Prioritize equipment that incorporates advanced dose reduction technologies, such as pulsed fluoroscopy and low-dose acquisition modes, and allows for optimization of image processing to maintain diagnostic quality at reduced exposure levels. Option B. Choose the fluoroscopy system that offers the highest possible frame rate for all procedures, regardless of the associated radiation dose, to ensure the most detailed visualization of cardiac structures. Option C. Select the imaging system with the lowest initial purchase price, as cost-effectiveness is a primary driver for institutional purchasing decisions. Option D. Rely on the default settings provided by the equipment manufacturer for all fluoroscopic examinations, assuming these are optimized for all patient types and clinical scenarios. The correct answer is A. Prioritize equipment that incorporates advanced dose reduction technologies, such as pulsed fluoroscopy and low-dose acquisition modes, and allows for optimization of image processing to maintain diagnostic quality at reduced exposure levels. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the radiographer to balance the need for high-quality diagnostic imaging with the imperative to minimize patient radiation dose. In cardiac interventional radiography, fluoroscopy is essential for real-time guidance, but it inherently involves ionizing radiation. The digital nature of modern systems offers advanced features that can impact dose, making informed equipment selection and utilization critical. The challenge lies in understanding how different equipment characteristics and operational parameters influence both image quality and radiation exposure, and making decisions that prioritize patient safety within regulatory guidelines. Correct approach analysis. The correct approach involves prioritizing imaging equipment that demonstrably offers advanced dose reduction technologies without compromising essential image quality for diagnostic accuracy. This aligns directly with the ARRT, as low as reasonably achievable, principle, a cornerstone of radiation safety regulations in the United States, as enforced by bodies like the FDA and echoed in ARRT standards. Specifically, selecting systems with features such as pulsed fluoroscopy, low-dose acquisition modes, and advanced image processing algorithms that enhance signal-to-noise ratio at lower doses represents best professional practice. These technologies are designed to achieve diagnostic efficacy while minimizing patient and staff exposure, directly addressing the core tenets of radiation protection mandated by U.S. regulatory frameworks. The ARRT-CI certification emphasizes the application of these principles in practice. Incorrect approaches analysis. One incorrect approach is to solely prioritize the lowest acquisition cost of imaging equipment, disregarding its dose reduction capabilities or image quality potential. This fails to meet the regulatory requirement to implement ARRT, as cost savings should not supersede patient safety and diagnostic efficacy. Another incorrect approach is to select equipment based solely on the highest available frame rate for fluoroscopy, without considering the associated radiation dose implications. While high frame rates can be beneficial for visualizing rapid motion, excessive use without dose optimization can lead to unnecessary radiation exposure, violating ARRT principles and potentially compromising patient outcomes due to cumulative dose. Finally, an approach that neglects to regularly evaluate and optimize the performance of existing fluoroscopy equipment for dose reduction, relying on default settings, is also professionally unacceptable. This passive approach fails to leverage the full potential of modern digital systems for dose management and may result in suboptimal radiation protection practices, contrary to ongoing regulatory expectations for continuous improvement in radiation safety. Professional reasoning. Professionals in cardiac interventional radiography should adopt a systematic approach to equipment selection and utilization. This involves 1. Understanding the specific clinical needs of the procedures performed and the imaging requirements for diagnostic accuracy. 2. Thoroughly researching and evaluating the dose reduction technologies offered by different imaging equipment manufacturers, referencing performance data and regulatory approvals, e.g., FDA clearance. 3. Considering the interplay between image quality parameters, e.g., spatial resolution, contrast, and radiation dose, and how digital system features can optimize this balance. 4. Implementing and adhering to established protocols for radiation dose management, including regular equipment quality control and optimization. 5. Staying current with evolving regulatory guidelines and best practices in radiation safety and interventional imaging. This comprehensive approach ensures that decisions are evidence-based, ethically sound, and compliant with all applicable U.S. regulations and ARRT standards. Question 20. The risk matrix shows a patient presenting for a complex percutaneous coronary intervention. The pre-procedural imaging reveals an unusual origin of the right coronary artery from the left sinus of Valsalva with a retroaortic course. Which of the following best describes the technologist's primary responsibility regarding cardiac anatomy in this scenario? Option A. Quickly confirm the presence of the coronary arteries and proceed with imaging acquisition, assuming the interventional cardiologist is fully aware of all anatomical nuances. Option B. Accurately identify and document the anomalous origin and course of the right coronary artery, considering its implications for catheter engagement and potential complications during the intervention. Option C. Report the anomalous origin as a minor finding and prioritize imaging the left main coronary artery, as it is typically the primary focus in percutaneous coronary interventions. Option D. Focus solely on visualizing the target lesion within the coronary artery, as the anomalous origin is a known anatomical variation and does not directly impact the intervention site. The correct answer is B. Accurately identify and document the anomalous origin and course of the right coronary artery, considering its implications for catheter engagement and potential complications during the intervention. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the technologist to interpret subtle anatomical variations in the context of a critical cardiac intervention. Misinterpreting the anatomy could lead to incorrect procedural planning, suboptimal catheter manipulation, or even patient harm. The technologist must integrate their knowledge of cardiac anatomy and physiology with the visual information presented, understanding the implications of each anatomical feature for the planned procedure. This demands a high level of diagnostic acumen and a commitment to patient safety, aligning with the ARRT emphasis on competent and ethical practice. Correct approach analysis. The correct approach involves a thorough and systematic evaluation of the cardiac chambers, valves, and major vessels as visualized on the imaging. This includes identifying the precise location and orientation of the atria, ventricles, aorta, and pulmonary artery, as well as assessing the integrity and function of the mitral, tricuspid, aortic, and pulmonary valves. Recognizing the relative positions and connections between these structures is paramount for understanding blood flow dynamics and potential challenges during catheterization. This aligns with the ARRT requirement for technologists to possess a comprehensive understanding of cardiac anatomy and physiology to perform their duties safely and effectively, ensuring accurate image acquisition and interpretation in the context of interventional procedures. Incorrect approaches analysis, focusing solely on the immediate target of the intervention without a comprehensive anatomical survey risks overlooking critical adjacent structures or anomalies that could impact the procedure. This demonstrates a failure to adhere to best practices in diagnostic imaging, which mandates a holistic view of the anatomy. Such an approach could lead to procedural complications due to unaddressed anatomical variations, violating the ethical obligation to provide the highest standard of care. Prioritizing speed over accuracy in anatomical assessment, even under time pressure, is a significant professional failing. While efficiency is valued, it must not compromise the fundamental requirement for precise anatomical identification. This approach neglects the detailed understanding of cardiac structures necessary for safe interventional radiography and could result in misidentification of anatomical landmarks, leading to procedural errors and potential patient harm. This directly contravenes the ARRT standards for competence and patient safety. Assuming standard anatomy without careful verification based on the imaging is a dangerous practice. Cardiac anatomy can exhibit significant variations, and interventional procedures are often performed precisely because of these variations or pathologies. Failing to meticulously assess the individual patient's anatomy based on the provided imaging demonstrates a lack of critical thinking and a disregard for the unique physiological context of each patient, which is a core ethical and professional responsibility. Professional reasoning. Professionals in cardiac interventional radiography must employ a systematic approach to anatomical assessment. This involves 1. Establishing a clear mental map of the cardiac chambers and great vessels. 2. Meticulously identifying key anatomical landmarks and their spatial relationships. 3. Considering the implications of any observed variations or pathologies for the planned intervention. And 4. Cross-referencing imaging findings with procedural goals. This process ensures that all relevant anatomical information is considered, leading to informed decision-making and the safest possible patient care. Adherence to ARRT standards for knowledge and application of cardiac anatomy and physiology is fundamental to this decision-making process.